Hello everyone, this is Dr. Demchenko, and today we will go through a cervical osteochondrosis complex that can be done without getting up from your chair. It can relieve pain and improve blood circulation. If you are interested in the detailed technique of execution and the main mistakes, refer to this video. And now just repeat after. For all these exercises, it's important to sit straight, straighten your shoulders, lower your shoulders, keep your neck straight, and we'll start with the upper cervical spine. We start with tilts to one side and the other side. It's very important to feel how the movement happens directly under the occiput, both right and left. The muscles stretch pleasantly and smoothly. During this, you may feel a slight sound, as if sand is pouring. Good. Now we're finishing with this exercise. It's very important that only the upper cervical section of the spine is working. Good, we're done. Also in the same position, we start doing the upper cervical rotation. The movement is not very big, but what's important is happening in the upper cervical section. If you can't make a movement in the upper cervical section, check out the techniques with the videos separately. Repeat after me in the middle tempo. We must feel as if we were hung by the back of our heads, pulling our head upward. Good, we're done. Now we're doing tilts and throwing our head back, specifically in the upper cervical section of the spine. Stretch, drop our shoulders down. Let's go. Nose up, chin tucked in, nose up, chin tucked in. Up, inhale, down, exhale. Inhale, up, down, exhale, inhale, up, down, exhale. Do not do it with other parts of the spine. Okay, we're done. Now we start to loosen the upper and middle cervical spine, passively. Put your hand on the side of your neck so that your little finger is just under the very back of your head. The second hand should go on your head, and we gently roll the head on the hand. Slightly push with your hand into the neck and slightly push with your head. The head and the neck are relaxed. At the same time, you can feel a slight crunch. This is normal. This exercise should not cause intense pain. Next, we move on to one vertebra lower and continue the bends. We do 4 to 5 bends. Move down one vertebra and continue the bends. When we approach the bottom of the neck, we move our hand flat and continue the bends. We go up for the second time, one lower, one finger lower, another finger lower. We change sides. The movements are smooth, soft. You can take a small breath at the end of the movement. One finger lower, and again one finger lower. And place the hand flat. Let's repeat from above. Now go lower. There may be slight pain or clicking, that's normal. Okay, we're done. Let's move on to the next exercise. Again, check that you're sitting straight. Retract your head and add a little pressure. Make sure that your head does not fall back. Move backwards with the back of your head, applying a little pressure at the end. It's important to feel good stretching of the muscles behind the neck and in the suboccipital region. At the end, we hold like this for a while. Good. The next exercise is for the lower back and the cervical-thoracic junction. We lift the chest up and twist. We lift the chest up and then slouch. Lift the chest up and then slouch. Place your hands on your knees, helping to push the chest upwards. Try to keep our head in place. You can connect your breathing exercises. When the chest comes forward, inhale, then exhale. Let's take the exercise to the next level. Roll your hands back and forward. In this way, the middle and lower chest sections of the spine are engaged. We bring our shoulder blades together on the inhale, and we round our back on the exhale. Head stays in place. And one more time, stretch the chest upward. And rotate the shoulder blades. And in the end, we collect your shoulder blades together, then pull up the chest, strain all the muscles, hold this position and relax. Inhale, gathering the shoulder blades, pulling the chest up, hold, exhale, relax. Again, inhale, gather the shoulder blades, chest up, exhale, relax. Well done. The next exercise is the mobilization of the chest department of the spine in rotation. Put your hands in such a way that it is comfortable for you. Then turn yourself to the send and make passive turns. Our shoulders don't help us. We do it only by the force of our hands. The head is looking forward and the shoulders are turning to the side. Because of this, we achieve mobility in the lower thoracic region and in the cervical-thoracic junction. And gradually we add a turn of the head to the other side. Well done. We move our hands to the other side, turning around. You may hear a slight crunch, that's good. And we add head rotation to the opposite side. The movement is small, but pleasantly stretches the back. Good, now let's slightly mobilize the ribs. Put your hands on the ribs and make turns with the ribs. Hold the ribs with your hands, turn them together with the body. Hands should be firmly gripping your ribs. You directly hold the ribs and turn them. Now place the hands down. During this, you may feel stretching sensations in the spine, along with the attachment of the ribs to the vertebrae. This is normal. And to the other side. Grab as high as possible and turn yourself. You can add breathing exercises to this. When you're making a turn, exhale. Put your hands on the lower ribs and continue. Okay, we're done. During the next exercise, we pull with the right hand to the side and turn our head with the shoulder to the opposite side. Now the opposite hand. Your amplitude can be large if you're comfortable doing it like that, but it can also be small. When the hand stretches out, exhale deeply. Okay, we're done. Wrap your fingers around the back of the neck. Fix your hands. And make bends in the cervical spine backwards. Our hands help us to exclude the intensive neck bending movements in the cervical spine. Good. Now we grab the neck in the same way. And we lean forward, but we don't tilt the neck down, only the chest part. Good, we're done. Now we stretch the trapezius muscle. We put one hand under the thigh and the other one goes behind the ear. Stretch the head to the side and turn the nose to the opposite side. You should feel a good stretch. Hold this position. Now we slightly press the ear to the upper arm, strain, and try to pull the arm out from under the thigh. Hold the tension for 5 seconds. Exhale, relax. Again, inhale. Press your head to your arm, exhale, and pull your arm out from under your thigh. Hold for 5 to 7 seconds. Again, inhale, press with our head, and try to pull out the arm. Exhale. Good, change the arm. If you feel dizzy during this exercise, exclude it from your routine. Make no more than 20% of your maximum possible effort. And the third time. Good. Now we stretch the scalene muscles. Fix your fingers like this, above and below the collarbones. The second hand goes on your face. And make slow counter-directional movements. The feeling of stretching shouldn't be there, but precisely on the scalene muscles. Do small dynamic stretches, you feel how the muscles are stretched, and do it on the other side. Okay, and we're done. This set of exercises can be performed twice a day for a month for the treatment of cervical osteochondrosis, or every 4 to 5 hours after prolonged work at the computer.